Next on In Close, the diagnosis no parent wants to hear and no child should ever get.
She had 80% leukemic cells, blasts all throughout her body.
By that time, the doctors were unsure about the future for her.
But a remarkable treatment at the Fred Hutch Cancer Center has put this little girl on the road to recovery. Next, we'll take you inside the Hutch, where doctors and scientists are at the forefront of the fight against cancer, discovering breakthroughs and pioneering new treatments. Cancer breakthroughs, next on In Close. Good evening, I'm Deborah Wong. Tonight we're going in close on cancer breakthroughs. You may have seen Ken Burns' latest documentary, Cancer, the Emperor of All Maladies. It's based on the Pulitzer Prize-winning book by Siddhartha Mukherjee. Seattle figures prominently in the world of cancer research. It's home to one of the world's preeminent facilities, the Fred Hutch Cancer Center. Tonight we're taking you inside the Hutch to show you some of the groundbreaking work they're doing. We begin with a promising treatment that's bringing new hope to cancer patients who previously were out of options. To undergo a bone marrow transplant, patients have to find an exact donor match. But as In Close producer Stacy Jenkins found out, there is another way.
She is our firstborn child. She's sweet and considerate, and careful and nice, and a great older sister.
Ava Lee loves to do the typical things any 6-year-old would.
I like to go in the backyard, and I like to play fetch with my dog, and I like to play pretend with my sister.
But unfortunately, Ava isn't just any 6-year-old. In February of last year, an ER visit for flu-like symptoms revealed devastating news.
They did a CBC, a routine check of her white blood cells and all of that, and they found that she had 80% leukemic cells, blasts all throughout her body, through her blood by that time.
Ava was diagnosed with biphenotypic leukemia, a rare type of leukemia that's especially hard to treat. Ava's parents, Esther and Mike, tried the traditional cancer treatments, but nothing worked. They were told by doctors that Ava's best chance for a cure was a bone marrow transplant.
The unfortunate thing was we could not find a match for her because we are of Asian descent, and my husband's Taiwanese and I'm Korean, and so that even made it a little bit more difficult to find a live donor.
Thank you, everybody, for praying for me.
By that time, we had heard so much bad news about prognosis and things like that, that we were in a bad place, you know, mentally.
But Esther and Mike weren't ready to give up. They frantically searched for additional treatment options. That's when a web search led them to Dr. Colleen Delaney at the Fred Hutch Cancer Center in Seattle.
So I happened to be on clinical service when a phone call came into my office and to the Seattle Cancer Care Alliance, our clinical arm, and it was Ava's dad calling and saying, hey, you know, I have a daughter who's 6, she has biphenotypic leukemia, and we're looking for options. She has no donor. So Ava, this is part of my lab.
As director of the Hutch's cord blood transplant unit, Delaney felt Ava was a good candidate for a cord blood transplant. And after months of despair, Ava's parents felt a glimmer of hope.
Mike went out and they conference called me in, and just talking to her, excuse me, she brought a lot of hope, because by that time the doctors were unsure about the future for her, and they were saying that this would be our last ditch opportunity, would be the transplant.
Cord blood transplants use the stem cells found in a baby's umbilical cord. This stem cell-rich blood is collected from the cord after the baby is born.
It's a source of blood that's been protected by the mother for the whole 9 months of the infant's life.
Cord blood transplants work the same way as bone marrow transplants, but there's one key difference. There doesn't need to be a perfect match between the cord blood recipient and the donor.
The immune system that is associated with that small bag of blood is very naive. It's uneducated, which means that we can mismatch a cord blood donor to a patient where we can't do that with an adult donor. And then what that means is you open up a whole new door, and we can find a donor for nearly every single patient who needs a transplant but can't find a conventional donor.
When she joined the Hutch in 2000, Dr. Delaney's goal was to improve the rate at which cord blood cells multiply. That would help patients recover from transplants faster. Delaney began her first clinical trials in 2006. All 15 patients responded positively.
Remember I was telling you we have to protect the cells?
After that success, Delaney began randomized trials across the country. That's when she got the call from Ava's dad and got Ava into a trial for a cord blood transplant.
Both eyes. There you go.
It was actually very anticlimactic. They hung a bag of the baby's blood, and after, of course, the frontline chemo and radiation, and when her body was prepared for the blood, it was just dripped right into her body. It took about 15 minutes.
The hope was that the cord blood stem cells would start to grow in Ava's body and create new healthy blood cells, a process known as engrafting.
Well, she engrafted at day 12, and when we saw that, I mean, we can't even put into words the joy that we felt knowing that this was working, that it actually, that the day came where she was getting a whole new chance, you know, at life.
More than anything is for people to understand that if you don't have a donor, it's okay. We're doing really well with cord blood transplants. The outcomes are the same. There's haploidentical transplants, that they shouldn't wait and wait and wait to find that donor, because there are just as viable options.
A few months after her transplant, Ava received some good news.
How do you think things are going?
Good.
Good? I think things are going better than good.
Great.
Great. I think they're going terrific, right? Because you hit a really big time point. Day 100.
Even with this great news, Ava still faces some hurdles. Cord blood transplant patients face a higher risk of infections, and because of her weakened immune system, Ava has to wear a mask nearly all the time. There are side effects, but Ava's mom says they're manageable, especially considering everything that this 6-year-old has already been through.
So we are actually on the other side of transplant, looking to go home in just a few weeks. We're just so elated that we're on this side and that we can go home and have a really wonderful story to tell.
Stacey, it really is a wonderful story to tell.
Yeah.
But I guess what's striking is that, I mean, this was a family that was really out of options, and it was a web search, it was an internet search that led them to this study. So do people really not know anything about this?
I think that there's, more and more publicity coming out about cord blood transplants. I think that the news is getting out that it's now a viable option. Up to now, cord blood transplants traditionally were only able to be used on children. That's because if you think about how much blood can be collected from an umbilical cord, it was a really small amount. So Dr. Delaney was telling me and explaining to me that they were only able to treat small people, meaning kids, with this.
Yeah.
Her research led to the ability to multiply these stem cells. So there's more of these stem cells, and now they can be used in adults. I think that it's just a matter of time before these trials, show the success rates, the news spreads, and the FDA approves it to be used, across the country and in most hospitals.
If this is years away from becoming widely available, what do you say to families who are in their position right now, who are really out of options and looking for something?
Yeah, I will tell you, Dr. Delaney cares about her patients. She cares about getting the message out that this is now a viable option. When I walked into her office, the walls are covered with pictures and letters and thank you notes from her patients. She insists that they stay in touch with her, and she really emphasized that anybody that is considering this as an option, anybody that feels like they've run out of options, should contact the Fred Hutchinson Cord Blood Transplant Center. She will talk to them, one of her team members will talk to them, and they will look at options available.
They'll figure it out.
Yes.
Stacey, thank you very much. Researchers say they now stand at a truly significant moment in the fight against cancer. If you watched The Emperor of All Maladies, you saw that doctors are more optimistic than ever about not just treating cancer, but finding a cure. Here's what filmmaker Barrett Goodman, who directed the film, had to say.
What we have achieved is a revolution in understanding. We understand cancer in a way that we never did before. We understand how it works, we understand where its vulnerabilities are, we understand where its strengths are, and that has led most cancer researchers, nearly all of the ones we talk to a place where they can say it will be 20 years, 50 years, certainly within 100 years, that we can attack those vulnerabilities very specifically.
That sentiment was echoed, perhaps even more enthusiastically, by the new president and director of Fred Hutch, Dr. Gary Gilliland. I sat down with him recently to talk about the state of cancer research.
I think we're at an inflection point where we can see this coming. We have many examples now where we have been able to cure individuals using these immunotherapeutic approaches, but we still have a long way to go to understand how we can most effectively utilize it, and also how we can understand why some patients don't respond and what we can do to help them.
What has everyone so excited are the immunotherapies Dr. Gilliland just referred to. So what is immunotherapy, and why does it have so many in the cancer world using the C word, C for cure? We sent in-close producer Niels Cowan to find out.
This is where they took the tumor out, and they fortunately were able to avoid the major muscle group, but they did sever some nerves, and so this area all down through here now is pretty much numb. The first day I found out, I don't remember exactly the details of it. I mean, it was just a regular fall day, and was thinking everything is fine. And the doctor called me, and I went to his office, and he said, "Got some bad news for you. This is cancer."
64-year-old Paul Hopkins was among the most active 60-somethings he knew until he was diagnosed with a rare skin cancer called desmoplastic melanoma.
The statistics are pretty grim. The 5-year survival rate is not good at all, I think, 18%, something like that.
Paul underwent multiple surgeries and expensive drug treatment, but the cancer kept coming back and spreading to other parts in his body.
Realizing that you're facing death, I mean, in a very concrete way, it definitely changes your outlook on life. It was fall when this was happening, and the leaves were dying, and so I kind of at times was feeling like that, like watching the leaves die, and I was kind of going inward and feeling that same sense of preparing to die in a way.
Out of options and losing hope, Paul's luck changed at last.
Finally, with Obamacare, I was able to switch providers and went to Seattle Cancer Care Alliance and the Hutch. They were just going to start up a program. It was brand new, and it just happened to hit at exactly the right moment. And Dr. Lee, Sylvia Lee, was going to be leading it.
The program was a clinical trial for an emerging type of cancer treatment known as immunotherapy.
Immunotherapy is really different from standard chemotherapy, radiation. Some people are calling it a living treatment because you're using cells from patients' bodies that are alive.
Immunotherapy uses the body's own immune system responses to counteract one of the world's most deadly and cunning diseases.
For a long time, people didn't think that your immune system would be able to recognize your own cancer, because your immune system is known to recognize things that don't belong in your body, like bacteria, viruses. Cancer is something that developed from your own body's cells. And what we understand now is that because your cancer develops certain mutations that don't naturally belong in your body, your immune system is able to recognize those alterations and attack them.
One of the first modern researchers to delve into these treatments is Dr. Stanley Riddell of Fred Hutch's Immunology Department.
In the 1980s, we started to use monoclonal antibodies. So these are now antibodies that would target molecules on cancer cells. And that was sort of the first evidence that you could use an immunotherapy and have a big effect in cancer. Our interest here at the Hutchinson Center has been more on T cells.
When the body's T cells attack a cancerous tumor, they are often tricked or suppressed by the disease. T-cell immunotherapy uses different techniques to aid the cells in overcoming these defense mechanisms and destroying the tumor.
And this is the mass that we were feeling right here.
In Paul Hopkins' case, his tumors made him a good candidate for a type of T-cell immunotherapy known as TIL, or tumor-infiltrated lymphocyte therapy.
TIL therapy is taking a patient's actual tumor, so you're surgically resecting that, and then you're growing the T cells out from that tumor. The idea is that there are certain T cells or white blood cells that have already been drawn to the tumor and they're trying to attack the tumor, but the tumor is putting them to sleep. And so if you can just take that piece of tumor into the laboratory and grow those actual cells that have already recognized the tumor, activate them, make them more powerful, select for the ones that are the most powerful, grow them out into the billions, and then infuse them back into the patient, you're taking advantage of the patient's own T cells and own ability to recognize the cancer and augmenting that so that it can eradicate the cancer.
The supercharged T cells grown from Paul's tumor took almost immediate effect.
Within 2 weeks, I could already feel a tumor that I had under my chin disappearing. It was just going away. Within a month, it was down to a small little ball.
12 weeks after, we couldn't see any cancer in his body. Now he's walking again. He's started to take 30-minute walks every day in the Arboretum and in Green Lake, and he's already asking when he can go skiing again. And so he is on his way to regaining his former life.
Remarkable stories like Paul's are emerging in greater numbers from the Hutch and other research centers, but not every treatment ends in success.
So far, it's only working in a minority of patients. The challenge is understanding why not every patient responds and what we can do to increase these response rates.
In another lab inside the Hutch, a team of technicians under Dr. Stanley Riddell are taking bold new steps with the next generation of immunotherapies.
Our focus has been actually to engineer T cells, to put in now a response that can see the cancer.
This approach uses synthetic receptors to program T cells to recognize and go after specific cancers. But perhaps the most remarkable effect takes place after the cells have begun their work.
The T cell will see the tumor and kill it, but the T cells will also then divide. So a patient can have several pounds of tumor, and you can treat them with a tiny kernel of T cells, a little pellet. Those T cells will grow up in the patient and continue to recognize the tumor until the tumor's gone. It's evolving so quickly right now, and I think that we still don't fully understand how to bring all of these things together, but I think that it's so exciting because I think the next decade is really going to allow us to do that.
For patients like Paul Hopkins, these early successes are nothing short of life-saving.
If I'd gotten this cancer 5 years earlier, I would have had no hope. There would have been really virtually nothing I could have done, and probably would have died within a few years. I feel like I got my life back is the amazing thing. I mean, I feel like it was slowly ebbing away, and I was not going to be able to do what I wanted to do anymore. Now I feel like there's a chance that I'm going to be able to get back to everything I love, and it's like a miracle as far as I'm concerned.
So Nils, it seems like for cancer patients, the promise of these treatments really depends upon what kind of cancer you have. This is not something that's available for all kinds of cancers.
Yes, currently, as Dr. Riddell said, it's being used mostly in leukemia, lymphoma, and melanoma, like Paul Hopkins had. But for other cancers, they're still doing the research. The main cancers that they really want this to work for are the common epithelial cancers, like breast cancer, lung cancer. And those trials are going on in animals, and they've shown success. And there's lots of promise there. And they will be starting the first human trials in May of this year.
Nils, thanks very much.
Thank you.
Finding a treatment for cancer is one thing, but equally important is understanding what causes cancer in the first place. Toxins, the environment, even genetics are all factors. But there's something else that causes 20% of all cancers worldwide. In Close producer Sabrina Register shows us how what Hutch doctors are learning half a world away is helping fight cancer here at home.
The images are heartbreaking. Children as young as 2 are suffering and dying from a form of cancer called Burkitt lymphoma.
It's actually the fastest growing tumor that we know of today. So it dramatically can start about the size of a grape and wind up the size of a grapefruit in just a few weeks.
But this form of cancer isn't caused by exposure to a harmful chemical or radiation. And it's not genetic. It's caused by an infection.
There are obviously many different types of infections, and in families we think about things like viruses, bacteria, fungi, and parasites. And it actually turns out that all of those categories, each of those types of infections can cause different cancers.
Dr. Corey Casper is head of global oncology at Fred Hutchinson Cancer Research Center. He studies the link between specific infections and certain types of cancers and says the connection is clear. Some infections do cause cancer. Take the bacteria that causes ulcers, for example. It also causes stomach cancer. Hepatitis is linked to liver cancer. Human papilloma virus causes cervical cancer. And the virus that's behind mononucleosis, Epstein-Barr, causes lymphoma.
This may actually induce more fright than sort of quell that. But 70% of us have at least one infection that we harbor chronically in our body that could cause cancer. But less than 1% of us develop cancer from that infection that's in our body.
But that 1% of people who develop cancer from an infection accounts for 20% of all cancers worldwide. So for Casper and his team, the goal is to figure out why, and they look to Africa for answers.
We know that about 60% of the cancers in East Africa are caused by infections, so much higher than we have here.
While enormous attention has been paid to health crises like HIV, malaria, and tuberculosis, the scales have tipped. Casper says in Uganda today, more people are dying of cancer than HIV, malaria, and tuberculosis combined. So he and his team are working with the children suffering from Burkitt lymphoma, hoping not just to treat them, but to find a way to prevent it through a vaccine.
The power of vaccination to eliminate cancer is incredibly potent. Cervical cancer is incredibly expensive to treat and not always effective, but right now a full course of immunizations is under a couple of $100, and it can prevent that cancer from ever developing.
Vaccines have been effective against some types of cancers in other countries. By studying Ugandan children from birth to see which viruses they acquire, Dr. Casper and his team may unlock answers and ultimately wipe out many infection-based cancers across the globe.
In my mind, it's sort of a win-win situation when you can do something that helps people both in sub-Saharan Africa and here in the United States. And I think that this work really has the potential to do that.
Sabrina, you mentioned that vaccines have been effective against cancer in some parts of the world. Where are we seeing that?
I think the best example would be in Taiwan. Hepatitis B, which causes liver cancer, was the leading cause of cancer among children in Taiwan. So that country implemented a universal vaccine at birth, a hepatitis B vaccine at birth, and it has all but eradicated the disease. Dr. Casper talked about HPV vaccine preventing cervical cancer, and they are seeing phenomenal success rates, 90 to 98% effective. Now, HPV, human papilloma virus, also causes a rare form of head and neck cancer. And doctors are now seeing if the vaccine that is used to prevent cervical cancer could be used to fight head and neck cancer.
Sabrina, thanks so much. Treatments such as chemotherapy and bone marrow transplants are critical in the fight against cancer, but local researchers are finding success in some non-traditional treatments too. In Close producer Layla Kazmi shows us an example of when music heals.
Hello, hello. All right, are we ready to make some music? My name is Betsy Hartman, and I'm a board-certified music therapist. I've been practicing for four plus years. Should we do improvisation or we just make up our own song? Alistair is a 4-year-old little girl. She's been at the hospital in and out for most of her life, or half of her life. She is incredibly spunky and has moved here from Montana. So she's here with her mom while her dad and her sister are back home, and she's receiving her treatment. My family were musicians, and growing up they always encouraged me to be involved with music and play instruments. But it wasn't until I saw harpists playing when I was a little girl, and I thought, that's an instrument that I want to play. And as I started playing it, I realized that it had an effect on people, whether it helped people relax or soothe people. Okay, here's your cat piano. So I find that with cancer patients, we use music in two main ways. I might be using it to help with some of their rehabilitation goals. When you feel so sick and you have so much medicine that you're taking, you're exhausted and you might not have the motivation to want to move, and it might hurt, it might be painful to move, and so music can be used as support to increase that motivation, to make moving fun. Oh my gosh! Sometimes they don't need to move and they just need to relax, but they're going through a really hard time in life. They're missing school and they're missing their friends and they're missing their routine, and so that's emotionally exhausting, and maybe we'll use music then to help them be aware of that.
Music therapy practice in the United States was first kind of recognized in the 50s. That was when the National Association of Music Therapy was established. But music therapy work has been going on here for a long time.
You do the hokey pokey and you turn yourself around.
Music is processed really throughout the brain.
Oh, I like that one.
And not only throughout the cortex, but also deep in the brain. I mean, our cerebellum is involved in rhythmic processing.
The nature of being in a hospital is following rules and getting things done to you to help you feel better. What you are. For kids, that's hard. For adults, that's hard. And as a music therapist, we can really come alongside them and meet them where they're at. If they need choices, we can give them choices and let them choose an instrument. And it's a simple choice, but it's a choice. But I wonder
what you are.
Yay! That was beautiful. You did it. High five. You're a rock star.
Some final thoughts. We've spent most of this show telling you about the work being done at Fred Hutch, but there are many organizations in Seattle and in the state of Washington working hard in the fight against cancer. The University of Washington Medical Center, the Seattle Cancer Care Alliance, Cancer Lifeline, Swedish Medical Center, Seattle Children's Hospital, Gilda's Club, to name just some. We've devoted a special webpage to the subject. Go to kcts9.org/cancer. You can see all of the stories from tonight's show, plus other stories. That's all for tonight's show. Remember, you can always send us an email, follow us on Twitter, and like us on Facebook. I'm Deborah Wong. Good night. Next time on In Close, the gender gap from the booming tech industry to workplaces around the state. Why women in Washington hold fewer jobs and make less money than their male counterparts. And how local pioneers are trying to end the disparity. The gender gap, next time on In Close, Thursday night at 7 on KCTS 9.